Okay. So these are the 12 questions I'm going to give you. Right. We'll see bit by bit, part by part. So this is Mr. Mcdonald. The name of the patient is Mr. Mcdonald. Mr. Mcdonald. So the name of the patient is Mr. Mcdonald. Details about procedure. One, two, and three. Right. So just focus on this part. Focus on the question. Question by question, we'll see. Lump located near. Removal of lump from back. Back. So lump located near something. So it's pointing. Where? Near Where? Near this. Location near the. So it is talking about the location. Worried about dash after operation. Worried about dash after operation. So here, worried about something after operation. So what is he worried about? About something. So whenever you are seeing the question, you have to see in a different angle. Right. First and foremost, see where the question is. So there, that sentence you have to focus. No need to focus on everything. So number one is in the second sentence. So lump located near. So here, near is very important. So near is very important. So near, located. Located means location. It is talking about the location there. So you have to understand location. Where is the location? Where is the lump located means the point, place where it is. Near dash. So removal from back. Removal of lump from the back. Okay. Lump located near something. What is that part named as? Name of the body part. So whenever you are writing the name of a body part, write the. So the next one. Worried about dash after operation. What was he worried about? So worried about something. After operation, some maybe complications arise. So he's worried about something. Okay. So this is a here located near something. Worried about something. Something is a noun. So try to understand. Most of the question will be based on nouns. So you should know. Located near something or someone. Located near something, near to something or someone. Only two things will be there. Object or a human being or some animal, animate or inanimate objects. So animate or inanimate objects. So here it may be something means inanimate, someone means animate. It may be even any animal also, something like that. So here located, lump located near something, not someone. So definitely because it is one individual, that is Mr. Mcdonald. We know that. So it's not someone, but it is something. What is that something? Where this lump located? So for example, if you want, where is the post office? Near the bus stop, near the railway station. That means these are called as markers. Markers means, it's easy to identify. Near where? Near which one? So this near is playing a dominant role here. Next, worried about something. Worried about something or worried about someone. Worried about something or worried about someone. So here may be chance. Okay, you can take these things. So always ask the question whenever the word before is very important. The word before is very important. Near, lump located near the blank. Before the blank, what is the word? That is very important. Because that is related. Worried about something. Forget after. After is not needed here. Remove that. Worried about something. After operation. After means when. After means when. So when, that is another question. When was he worried? After operation. So after, before, that means this is timing. Means when. That part after operation is answering the question when. About is answering the question what. Worried about what? Worried after when? Worried when? So you have to take the bits and pieces. Now I'm going to show you these things. If you can identify, it will be very easy for you to understand. Now let us see here. So this is the big word here. Lump located. Lump is not a new word. It's already there in the previous sentence. Is already there in the previous sentence. Removal of lump from back. So lump is already there in the previous sentence. So it's not important. So now how to know which word is important? Which word is important is very, it plays a very special role. So located is the size of the word is very big. So located is important. Already the word which has come earlier, that will not be important. So location. Removal of lump from back. Location. That's all. Location. Lump located near. Full, if you give one word, it is location. So it is talking about the location, where it is situated, where it is occurring. So identify the synonyms. Present, situated, located, okay, occurring, present. So these are the words which are synonyms. Near, close to. Near what? Near what? Location. Near what? Here he is talking about the location. Here he is talking about the location. Where is the location of where is the site? Where is the site? S-I-T-E. Site has three spellings. S-I-T is site, S-I-G-H-T site, C-I-T is site. C-I-T is site means a verb. S-I-T is site is a noun. S-I-G-H-T sight, eyesight, vision. So now here you have to identify. Location means place. Where it is. Near. Near what? So near what? Near what part of the body? Near which part of the body? Or what part of the body? Or which part of the body? What or which? Both refer to something. Both refer to something or someone. But someone is ruled out. So something is coming. So located near. So remember, he will tell you about a body part. So that body part is very important. So back. Back. When you say back, what are the parts there? Shoulder. Shoulder. Right shoulder. Left shoulder. Neck area. Okay. Lung area. Okay. Or back side of the lungs. Or here. Hip area. Or waist area. Or stomach area. So, you know, back is called only, this is front and this is back. Body is this, from here to here. From here, inside, and up and down. So this is the rectangular area. This is the body. So back of the body, front of the body. So try to understand that. So once you identify these things, you will understand it. So it may be near the right shoulder or left shoulder, because two shoulders are there. Right shoulder or left shoulder. Or else, you know. Now, seeing the body parts, you can see here, stomach, chest, waist, hip, shoulder, shoulder and hip, shoulders and hips. So right hip, left hip, right shoulder, left shoulder, the right shoulder, the left shoulder, the left hip, the right hip. So because they are dual, so you have to be very specific. Where is the lump exactly? So now what are the other parts body related to? So near the shoulder, not shoulder, near the shoulder, near the right shoulder, near the left shoulder. Okay. Or you can say stomach area, or waist area, or hip area. So these are the words which will come. So you have to listen for that particular word. So what name of the body part? So which body part? What or which? What or which? So what or which? Here it is related to the body part. Located near body part. So which body part is it talking about? You have to be very specific. So before the audio starts, you should be ready with all these things. Then first question is done, finished. So you have to identify which word is important. How do you know which word is important? Already existing word, already occurring word, it's common. So remove that one. Lump is there, common. Then next one, which is the main word? Main word or operating word. That means which is the biggest word, the biggest word. So that it revolves around the biggest word has the power. So located, make it into a noun form, location. Where is the location of the lump? Where? Near what? So location, maybe the right shoulder, the left shoulder, all these parts, any part, one may be there. Only one. Because lump located near, not lumps, only one. So one will be there in one area only. So it should be specifically one particular area, not shoulders, not hips. So you have to understand that very clearly. Next one, worried about. So worried about dash after operation. After operation. So you have to break the sentence into parts. Worried about something after operation. After operation is not important now. Worry is after operation, that is very clear. So that is already cleared. He is worried regarding the condition after operation. There is no question there. So no, about something. So worried about something. So this worried, we are going to transform this word into noun form. That is worry. Worry. So he has worry. So worry related to what? About what? So about what? What was worrying? Which thing was worrying? What and which are related to nouns. So noun is a major operating part of speech. So you have to understand that one. Worried about something. Worried about something. After operation, forget it. Eliminate it. That's ruled out because there is nothing important there. Because already everything is clear. Worried regarding the condition after operation. So worried about something. Now he is worried about something. He's thinking about after operation condition and he's thinking about something. Worried about what? So normally after operation, okay, he may be worried about. After operation, they cut. There may be a scar. There may be, some bleeding, or there may be something else. There may be itching, or there may be after effects, or side effects, or whatever it is, or medication. He may be worried about something after medication. So the lump will be removed. After removing the lump, that means it will be cut off. After removing, what will be there? Where the joint is there may be some scars, there may be. So if you imagine like that, so something will happen after operation. After operation, what happens? It's cut and joined together, stitches and that. So he may be worried about stitches. He may be worried about the scar. He may be worried about the mark. He may be worried about the, the cut, whatever it is. Worried about the skin color or what? Anything may be there. So that person will particularly. So worried about what? Worried about which? So there, something again. He is worried about something. What was that something? Name of that something you have to write. So name is very important. 50% of the questions demand the name. So if you try to understand that one, it will be very easy for you. Okay, it will be very easy for you. And then you can say after operation it will be wet, or it becomes softened because it has got some sutures and other things, some medication, whatever. So maybe he may be worried about healing process, or maybe he may be worried about any damage to the skin. He may be worried about a wound healing. So you have to imagine like that. What is he worried about? After operation, there is some damage now. That damage. So maybe color of the skin, maybe so there may be some other problems like if care is not taken properly, it will get some sort of infection. So worried about infections. Anything may happen. So he may be worried about anything. For example, sometimes wound, if it is not taken care of, infection may come. So that's why you have to be very careful. Wound cleaning process, regular, changing of dressing and other things should be there. Okay, fine. And if it is not taken care of, yes, gangrene also will come. A lot of things. So you have to imagine like this. Start imagining. If you start imagining now, tomorrow it will be easy for you. Maybe after doing 5 or 6 tests, it will be very easy for you. Right. Anila Sharath.
Yes, sir.
Is that clear? My voice is clear for you?
Yes, sir. Clear, sir.
The screen is clear?
Yes, sir.
Any confusion regarding anything?
Nothing, sir.
Explanation is clear?
Yes, sir.
Okay. Randomly, I'll call somebody and ask doubts like this one, so you can clear. So everything is done. This part of, so there are 5 different things. Mute your phone, please. So there are 5 different things which are very, very essential. Very, very essential. Number 1, names. Number 2, numbers. Number 3, difficult words. Number new vocabulary. Then next one is difficult words. Then special words and phrases. So you have to identify these things. They are very, very important. So first question and second question. Right. Hello, Dr. Abdul Basit. Yeah. So next one. Right. This is the first one. Okay. That's done. So we are moving to the, yes. Next part. Next part is medical history. Which is there on the left side, I am putting in the right center. Nothing is different, only this one. Because I want it, I can't widen it, I can just skip it out short. So there are 2 points here. Yeah. Only one question is there. Right. So let us see here. Now the second part is medical history. Medical history. Medical history. History means past. History means past. So when you say medical history, history means past. Right. History means past, not the present. Okay. History means past. You should know that history means past. So has something. Has something. Mcdonald has something. So every time you see something is coming, that something is very, very important. That is a noun. Okay. That is a noun. And duration, approximately 5 years. This something, the duration, approximately 5 years. He has had this problem for the last 5 years, or for 5 years. He has something. What is that something? Maybe diabetes, maybe hypertension, or maybe something else. Medical history. The duration of this problem is approximately almost 5 years. Approximately means not exactly, approximately, near about. maybe this side or that side. Approximately means maybe more than 5 years or maybe less than 5 years. But it is close to 5 years. That means 4 years, 8 months, 4 years, 10 months, or 5 years, 2 months, or 5 years, 3 months. So that is the range, 3 this side and 3 that side, close to that. That's the meaning. So that means 5 is mentioned because it is close to that. But we don't need that one. That is not important because that doesn't give any weightage. Has something. So what is that something? So after this session, there will be reading session, 9 o'clock. So don't miss the session. All right. So, so has something. What is that something? Has hypertension, has diabetes, or some other problem. So you have to realize that one. What is that something? Listen, he will tell you. He will tell you what is that something that you have to catch. That means he has some problem, ongoing problem or continuing problem or some serious problem, which is prolonged problem. Okay. Prolonged problem is a serious problem. So he will give you the clear picture. Right. So medical history has dash. Has means present tense. History means past tense. Has means present tense. History means past tense. That means prolonged from past till present. Past till present. So has had. He has had diabetes for the last 5 years. Or he has had hypertension for the last 5 years. Has had. That means for a long time. So whenever it is, even in your writing, this key you can use. If you take the audio script and put in front of you, you can get the sentences which you can write in the OET writing. But nobody will bother about all these things. Listening script, just listen and forget. No, it's quality. If you listen to that one, you will get quality. That is why you are not able to understand. Okay, so now here he has some problem. What is that problem? What is that sickness? What is that disease? What is that ailment? Whatever it is, he's going to tell it. He's going to name it. That's something he will particularly tell the name. So don't miss that. Physical problems. Everything will be related to problems only. Everything will be related to problem because this is a problem. This is a case. Case means a problem. Problem means difficulty. Difficulty means sickness. Everything related to it. So we have here 4, 5, and 6. 3 points are there in this. I think that's fine. Right. That's okay. So now here, trouble dash. Trouble for what? Trouble walking, or trouble reading, or trouble sitting, or trouble sleeping. Because he has back lump and it is cut off, it's removed. So now trouble will be there while sleeping. Maybe he has to lie down like that, and on his back he has to lie down. He may have trouble sleeping, or he may have trouble while walking. Okay, falls over sometimes. He falls down, he falls over the floor sometimes. That means he's not able to manage his weight. So he has some trouble. That is what he's telling there. Sometimes freezes in one spot. He doesn't move. Okay. He gets stuck in that place and he doesn't know what to do. just suddenly freezes. If the children play, freeze, automatically they'll stop like that. So he freezes in one spot, no movement, just get stuck like that. And he's not in a control. The name of the problem he has given, akinesia. Dash, shake a lot. Dash arms, dash, shake. Shake is a verb. So before that verb, something shake a lot. Something shake a lot. Shake, not shakes. Shakes is a singular, adding an S. Hand, arm, shakes a lot. But arms shake a lot. So there is a plural. There is a plural, shake. So if there is no word before, then the next word is important. Head shakes a lot. Right hand shakes a lot. Left hand shakes a lot. But hands shake a lot. So there is plural. Identify the reality there. Unless and until you identify and read between the lines, you will directly listen. What you will get there? Nothing you will get there. Because you don't understand anything. You have to understand everything from here. 90% of the answer is here. Dash arms. So some adjective, maybe feeble arms, weak arms, shaky arms. So adjective will come. Okay. Trouble doing something. So first one, fourth one is trouble doing something. Trouble doing something. Trouble walking. So gerund will come. What is a gerund? The ing form of a verb is called a gerund. The ing form of a verb is gerund. Trouble sleeping, trouble walking, trouble drinking, trouble eating. So action plus ing, trouble doing something. Doing something. He faces trouble while doing something. So why don't you understand? Trouble is a noun. So verb must come. And that verb will come in the ing form. That is called a gerund. Trouble getting up. Trouble lying down. Trouble standing up. Trouble walking. So, what type of trouble he is explaining here? Trouble swallowing. Maybe ing form. He faces trouble. He has trouble swallowing food. While swallowing food, he faces trouble. That's the meaning there. The next one, you see, falls over sometimes. So ignore. Sometimes freezes in one point, ignore. Dash, shake a lot. So here there are more than one. More than one. That means you have to understand there. Maybe legs shake a lot, or hands shake a lot, or knees shake a lot. So what is that? So plural. Then dash arms. Arms. So here you will get an adjective. So you have to realize that adjective. The next. Problems with daily activities, activities of daily living. All these things which you are seeing, you will write in the writing. Why don't you go to the listening part, take the listening script, print out and see wonderful sentences you will get. The same things you can write in the letter. You don't relate these things actually. And these are said by the professional. So definitely it will be correct. Problems with daily activities. When I'm telling you, I mean it. It's a web version. They are all interlinked. All the skills are interlinked. If it's called united we stand, divided we fall. You people are falling because you are not understanding the link between all these things. Reading, listening, writing, speaking, if you take them separately, you will not gain much. Listening is related to writing. What all you learn, the sentences and structures and everything, you can put as they are in your writing style. He has problems with performing the activities of daily life. Okay. So the same sentence he will be speaking there. Why don't you take that words and put them as they are in the sentence? No, we don't want. We don't have time. We are busy, sir. We are working. We don't have time. Okay. Okay. If you cannot help yourself, then who is going to help you? Right. If you don't have time for the OET before the exam, the OET will not have time for you. It will not give you grades, definitely. Afterwards, will come out crying, sir, I could not do well, sir, I am upset, sir. Huh? Yes. So trouble dash. Oh, sorry. Yeah. Dash in bed. Problems with daily activities. Dash in bed. What dash in bed? Reaching for things. Reaching for things. So problem with daily activities. So what are the problems? He cannot take bath maybe. So wiping on the bed itself or doing some activity in the bed itself. So you have to listen to what he's telling. Okay. So he cannot walk, he cannot move, he cannot, all the problems. Reaching for things. He has problems reaching for things. So for example, he wants water, he has to go there, take a glass of water. It's very difficult for him. Turning around. When dash from a chair. Dash from a chair. Getting up from a chair. Or rising up from a chair. From, he's in the chair. So from there, from a chair, is getting up maybe. When standing up, or getting up, or rising up. Okay. Try to understand there. Here only you'll get half of the answers. Turning around, because he cannot dash. So he will turn around, catch hold of something and just try to get. Turning around when getting up from the chair, or rising up from a chair, or standing up. Okay, fine. Tying shoelaces. He has problem tying shoelaces. That's not important for him. Doing and undoing some things. Doing something. Doing is a verb. And verb has an object. Doing something. Undoing something. Okay. Maybe dressing and undressing. Okay. So doing something and undoing something. So both doing something. This something is related to both doing and undoing. Untidy dash. Untidy attire, maybe clothing, how he dresses himself. All haphazard manner. One thing goes here, one thing goes here, like that. So he is not able to manage all these things properly. So it may be different points. There may be different points. So try to realize that. Dash in bed. What a person may dash in bed. So realize that one. So he is in bed. Sleeping in bed maybe. Okay. On the back. Okay. Then next one, turning around when dash from a chair. I already told you, gave you 3 points. Doing and undoing something. What doing? Doing something. Untidy. What? Again noun. Okay. So when, while, they bring get gerund. Whenever you use whenever you use when or while, you use a gerund. While sitting, difficulty while sitting, difficulty when sitting, problem when eating, problem while eating. When and while, they will get a gerund ing form. While means during. Ing form should come there. So doing some activity there. From a chair means getting up from chair. Ing form should be there. Doing and undoing. Doing something. Doing an action. What is that action? So try to understand that. What is that action? So here comes verb. Doing is a verb. So doing something. Something is a noun. Untidy is something. Untidy is an adjective. Adjective, after adjective, you will get a noun. After verb, you will get a noun. After adjective, you will get a noun here. Untidy dressing, maybe. Untidy attire. Untidy clothing. Is not very neat, because he cannot manage all by himself. So these are the two things. Next one. So, for example, now let me give you one example. This is my shirt. Now I fold my shirt. I am doing the folds. I am doing the folds. I am doing the fold. Then undoing the folds. Many examples are there. So doing and undoing. So daily living activity. This every day I have to do. Okay. Sometimes I go out. I wash my hands. Then I remove the. Yeah. This is another one. See here. This is button. Buttons. I am buttoning. Doing and undoing. Now I did the buttons. And I am undoing the buttons. Doing the buttons and undoing the buttons. Maybe you will not realize. If you think, you will get folding the sleeves and unfolding the sleeves. So doing and doing the folds. I am doing the folds now. I am doing the folds. Now I am undoing the folds. And I am doing the buttons. I am doing the buttons. See, this is doing the button. Now undoing the buttons. When I want to remove, I have to undo that. What I have done, I have to undo. That means while dressing, this is a problem while dressing maybe. Okay. So this is how it may be. So what you do and what you undo. Okay. Fine. All these things may be there. Untidy appearance may be, untidy looks may be, untidy attire, untidy dressing, untidy clothing, untidy bedding, untidy bed sheet, untidy pillow. Okay, anything may be there. So this is the way how you have to think. If you do 10 tests like this, automatically your mind will run like mercury. You put mercury on the floor, okay, then it will not stop, okay, until you find, you cannot find anything there. Okay, next one. Slide not appear. Somebody has a problem. Let me reach out. Yes. Janitor. Hello, Jenny.
Hi, sir.
Is the sound clear?
Yes, sir.
Is the slide clear?
Yes, sir.
Everything is perfect?
Yes, sir.
So
No problem.
whoever has a problem, you have to go out and come in. So there is no problem from my side. Okay, fine. This is how it is. Next one, the last one, 11 and 12 questions. Other issues. So here there are 4 paragraphs. You don't know here, this is a letter. This is also a letter like that. There are 4 paragraphs. First one, general introduction. This is the introduction. You're talking about Mcdonald and his problem. And here is the history. And here is the other problems. And here are the problems with daily activities. Try to understand that. The same thing. This is indirectly a letter. You can see the points there. First one is the introduction. I am referring Mr. McDonald, whose lump has been removed from the back recently. And I am referring for further care and management. That is the introduction, first one paragraph. See, details about the process. This is nothing but the first paragraph. Then this one, medical history, you are writing. This is the second paragraph. Physical problems or management, that is third problem. And problems, fourth paragraph. Four paragraphs are there. This is how you have to divide your paragraph also. If you look at the listening, then you will understand what it is. And we don't bother. And listening means listening only. What do you know? It is called integrated syllabus. You learn a lot of things from listening, and those things you can use in writing, and you can also use in speaking. And listening comprehension is almost the same as reading comprehension. Here you only use your ears, there you use your eyes. That's all. In listening comprehension, you will use your ears. And reading comprehension, you use your eyes, nothing ears. So they are related. And we make isolation. You there, I here. There is no unity. Like in a family, mother watches television, father does the computer work, child plays video games, another child crying. No unity in the family. So here there are 4 members in the family: listening, speaking, reading, writing. No, 7 members. Grammar, vocabulary, pronunciation. All these are 7 group members. They are called 7 sentinels. That is what the title of you can see. 7 sentinels. You see them as 4 skills. There are 3 including. These 3 things are involving and merging everything together. Vocabulary. What vocabulary you use in the listening, you hear in the listening. If you don't listen properly, you cannot write, you cannot speak. Reading. What vocabulary you use in reading, that you can write and you can speak. Right. Next. Okay. So here it is very important for you to identify the different concepts. I'm not teaching you listening today. It's a listening, but I'm not just teaching you listening. I'm teaching you the core curriculum of OET. OET, listening, is based on vocabulary. OET, listening, is based on grammar. OET, listening, is based on pronunciation. These are, you can say, lungs, heart, and kidneys of any language. And you don't bother about these things. You want to do listening, you want to do reading, you want to do writing, you want to do speaking, ignoring grammar, vocabulary, and pronunciation. How many of you bothered about pronunciation? Where is the drawback? We want listening, sir. Where is the drawback? You want listening. But what about the grammar? What about the pronunciation? What about the vocabulary related to that? Concentrate, which is something more important you are missing. At least wake up from your slumber. It's not sleep, it is slumber. We don't even realize that we are asleep, fast asleep. Even if elephants trample on you, you will not wake up. Like that sleep you are in. Slumber. Deep sleep is called slumber. Vocabulary, vocabulary, and vocabulary. No one can play the fool with vocabulary and score good results in the OET. Okay. Now let us see here. 2 questions. Cramps at night. Cramps at night. 12 months. Patient's dash is affected. Something is affected. Something is affected. Is a verb. Before is. Patient's something. Patient's head is affected. Patient's brain is affected. Patient's leg is affected. Right leg is affected. Or patient's stomach is affected. Patient's digestive system is affected. Patient's nervous system is affected. Whatever it is, patient's something is affected. Something is affected. Or not somethings are. He's telling is single. It's single. Singular number. Something is affected. So it's not patient's legs are affected. It's patient's right leg is affected. Patient's left leg. Even if they are dual parts, it is one thing. Remember that. Is pulling you to one side. Many things you have to learn from this. Read between the lines and you will understand. You want the answer. Don't go for the answer. First try to understand around the answer. Patient's dash is affected. Is a verb. Before is, noun will come. So what is affected? So you have to, that's a singular number. That's a noun. That's a singular number. And that's a common noun. It's a noun. It's a common noun. Common noun. Like patient's brain. Brain is a common noun. Not like a proper noun, special noun. Like Abraham Lincoln. No. Recently changed medication. Recently changed medication. Cramps. Something happened to these cramps. Maybe subsided. Maybe flared up. Maybe reduced. Okay. So try to understand this. Cramps, noun. So next verb will come. Cramps reduced, cramps minimized, or cramps subsided. So something will come like that. So you have to realize what he is telling you there. Okay. What he is telling. See, if you realize that, then you will understand. Now I am going to play the audio. Yes, how many of you are ready for this? Just type yes. Don't raise your hand. If you are ready for the test. If you have any doubts, you can ask me now itself. Just type the yes there. I want to see the people in action. Yes. Yes and a yes. Okay. Right. So I have given you all the things there. And some people don't have time to even type yes. So busy they are. Fine. That shows how ready we are to obey the commands when we want to learn. Obey the calling. Calling means learn. Learn. Somebody is telling you to learn. Somebody is telling you to do. Readiness to do something is the ultimate demand, which cannot be negotiated under any circumstance. If you want success, obedience, absolute obedience, unquestioning obedience. It is your calling. What is your calling? OET is calling you. Do this, do that. That's all. If you want to do this way, do that. If you don't want to do that, and many people, they just do the OET listening on the computer, on the mobile phones, on the laptops. Please don't do that. Do the OET way. Be a Roman in Rome. If you are doing listening, do like listening. Don't manipulate listening test for your own convenience. Sir, I cannot print out, sir. So why are you writing OET? I cannot go and take printout, sir. Why to waste that much money, sir? I can do it on the mobile phone only, sir. You know? You know? When you are doing on the mobile phone, you cannot even underline. You cannot even circle. You cannot put arrow marks. You cannot write anything there. That's it. So be careful. Do the OET in the OET way. Many people might have written 2 or 3 times. Or at least you have done so many mock tests. Then you'll know the difficulty in finding marking or underlining or shading or whatever it is. Circling the words is very difficult. So when you are active, hyperactive, then you will underline everything. If you don't move your hands, you will be lazy and your mind also gets lazy. Yes. Be active. Hyperactive people, they do many things. They do many things. They never even rest for a second. Yes, yes, and a yes. Right. Very good. Now we are going. So this is Mr. Mcdonald. I've got everything here. Fine. Right. Yes. Okay. Yes, part A.
Mr. McDonald. For the questions below, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. McDonald. I understand you're here to have a lump removed from your back, and the plan is to send you home later today.
Yes, that's right. The lump really needs to come off. It's more than a little annoying and can be quite painful too. It's right near my waist and gets in the way of the waistband of my trousers. I'm not particularly worried about the surgery. They explained everything to me very clearly when I was in the assessment clinic, but I'm concerned about how I'll go on later when I'm recovering. Did they tell you I have Parkinson's disease?
Yeah, it's here in your notes from the clinic, but it doesn't say how long you've had it or anything about how it affects you.
Oh, I've had it for a few years now. 5, I think. The walking is the worst. It's difficult to start moving, and I'm so slow. All I can do is shuffle to start with, and then my steps get shorter and shorter, and I get faster and faster. Sometimes I even fall over.
Do you have any other physical problems?
I sometimes get the freezing thing that happens, where you're stuck in one spot.
Akinesia?
Yes, maybe. You'd know better than me anyway. It'll come on to me when I least expect it, and it's always at the worst possible moment. I worked out if I try to do more than one thing at once, it almost always brings it on. I also get this terrible shaking in my hands. It's hard to do some things sometimes because my arms are so stiff.
What activities are most difficult for you?
It sounds ridiculous, but it's mainly things like turning over in bed, reaching for a glass of water, getting up out of the chair and trying to turn around once I'm standing. I've learnt a few tricks to help though, like having a good firm mattress and a high back chair with arms.
Well, that's good. What about activities that need fine movements? How do you manage with those?
Well, tying my shoelaces is a real problem, and buttons. Doing up and undoing those things is almost impossible. I like that material that sticks to itself. It's very handy. What's it called again? Velcro? That's it. Also, my handwriting is terrible. I've basically given up on it.
It really sounds like you might benefit from seeing an occupational therapist.
Yes, maybe. I'll have to speak to my GP about a referral. One of the other major problems I've had in the last 12 months has been the cramps I get at night. They really ruin my sleep.
I understand your medication has been changed recently.
Yes, that's right. I said to the doctor that the cramps had gone on far too long, so she said I should try some different tablets. I've only been taking them for a month or so. I think they've already reduced the cramps.
Yes, we are not bothered about the answers right or not. So I'm going to play it again, and you can write in your notebook, all of you. Don't write anything in the chat box. Okay? If anybody writes in the chat box, I will not accept. So,
Mr. Mcdonald. For the questions below, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. McDonald. I understand you're here to have a lump removed from your back, and the plan is to send you home later today.
Yes, that's right. The lump really needs to come off. It's more than a little annoying and can be quite painful too. It's right near my waist and gets in the way of the waistband of my trousers. I'm not particularly worried about the surgery. They explained everything to me very clearly when I was in the assessment clinic, but I'm concerned about how I'll go on later when I'm recovering. Did they tell you I have Parkinson's disease?
Yeah, it's here in your notes from the clinic, but it doesn't say how long you've had it or anything about how it affects you.
Oh, I've had it for a few years now. 5, I think. The walking is the worst. It's difficult to start moving, and I'm so slow. All I can do is shuffle to start with, and then my steps get shorter and shorter, and I get faster and faster. Sometimes I even fall over.
Do you have any other physical problems?
I sometimes get the freezing thing that happens, you know, where you're stuck in one spot.
Akinesia?
Yes, maybe. You'd know better than me anyway. It'll come on to me when I least expect it, and it's always at the worst possible moment. I worked out if I try to do more than one thing at once, it almost always brings it on. I also get this terrible shaking in my hands. It's hard to do some things sometimes because my arms are so stiff.
What activities are most difficult for you?
It sounds ridiculous, but it's mainly things like turning over in bed, reaching for a glass of water, getting up out of the chair and trying to turn around once I'm standing. I've learnt a few tricks to help though, like having a good firm mattress and a high back chair with arms.
Well, that's good. What about activities that need fine movements? How do you manage with those?
Well, tying my shoelaces is a real problem, and buttons. Doing up and undoing those things is almost impossible. I like that material that sticks to itself. It's very handy. What's it called again? Velcro? That's it. Also, my handwriting is terrible. I've basically given up on it.
It really sounds like you might benefit from seeing an occupational therapist.
Yes, maybe. I'll have to speak to my GP about a referral. One of the other major problems I've had in the last 12 months has been the cramps I get at night. They really ruin my sleep.
I understand your medication has been changed recently.
Yes, that's right. I said to the doctor that the cramps had gone on far too long, so she said I should try some different tablets. I've only been taking them for a month or so. I think they've already reduced the cramps.
Listening, Part A. You hear a doctor talking to Chloe, an outpatient in the psychiatric.
Patient, Mr. McDonald.
okay. Having done that, we are going to check our answers and prove that our theory is right. Okay, let us see. There are answers given in these papers also wrong. You don't know that somebody is putting something. Original papers are correct. I'll prove you some answers here. Okay, fine. So you may think that it is right and you'll give mark. But in the real exam, you will not get that mark. So we'll see that. You will know that from our results now. Okay. Now everyone action. Okay. In your notebook, you have written the answer. Until I tell you to submit the answer, nobody is supposed to submit. Please, I request you, don't spoil the show of others. If you just want to prove that you are excellent, don't just push the answer, please. Together, united we stand, divided we fall. So don't spoil the show of others. Right. Let them also do their work. Let them type, let them give. So I'll count till 7 to 1. Then I will tell, then submit, then you have to submit. So now, so let us go to the, yes, here we have, right. Fine. Right. So question number 1. Question number 1, lump located near. This is question number 01. So question 1. Type and keep it ready, but don't submit. Question 01. Type and keep it ready, but don't submit, please. Please don't submit. It's a request and also a warning. Right. Type and keep ready. Question number 1. Lump located near a dash. Yes. 7, 6, 5, 4, 3, 2, 1, and submit. Yes. Right. This is question number 1. Right. The right answer. Has everyone written? Let me check. I won't wait for, okay. Yes, most of them have done, so we need not wait. Okay. So the right answer is actual 100% right answer is, this is the right answer. Okay. This is the right answer. So this is the right answer. The without or with is okay. The waist, because it's a body part. It's body part. The waist. But waist is also right. No problem. Because you have got the essential thing. But the waist is absolutely right. 100% grammatically, perfectly right. But if you don't write the also, mark will be given. Okay. But you are not supposed to write capital letter. Hima Teresa, you are not supposed to write capital letter. Romila chest is wrong. And Hima W capital letter, no. Jayvant chest wrong. Manpreet Kaur W capital letter wrong. Monica W capital letter is wrong. If you write the same spelling with capital letter, you lose your mark. Right. Now, question, type and keep ready. Question 02. 7, 6, 5, 4, 3, 2, 1, and submit. Yeah. Right. Now here, so most of the students, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. What about the rest? Yes. Okay. Passive participants. Okay, fine. No worries. So the right answer, okay, which is given in the question paper is recovering. So the right answer is recovering. But worried about recovery after operation. Recovery is also suitable. Worried about recovering after operation. Recovering. Actually, this is a process. Okay, this is a process. Name of the process or gerund, recovering, is more suitable. And what you heard is also recovering. That sound you have to listen. It's not recovery, it's recovering. Sound. Sound, pronunciation. He's testing your pronunciation. You will get the mark only if you write ing, not y. Because you are tested for your sound here. Not tested for something else, just the word. Did you hear the sound? Landing, standing, that sound, sound should come. ing sound is Actually, the sound is tested there. These are called nasal sounds. Nasal sounds. Are you able to identify the nasal sound? Sound is tested here, not the word actually here. Are you able to identify It's not standing. It's standing. This is sound will come from the nose. Are you able to identify that sound he is testing? If you write Y, that means you are not able to identify the sound. If you are writing ing, that means you are able to identify the sound. Okay. Problem regarding. So if you write recovery, there should be the recovery. Okay. But here, it's not recovery. It's not the noun. It's the verbal noun. Same, both are same. Recovery and recovering, both are related here. This is verbal noun, that means it's a gerund, and this is a noun. So these are nasal sounds. Your lips makes irritating sound. And sound comes from nose. Mouth will be open. Lips will be closed. Lips will be closed. And sound comes from nose. And you will feel itchy sensation. Irritating sensation from the nose. You will feel like scratching the nose. Na. When you say that sound comes from nose. Mouth is open. Mouth is closed. Na. Mouth is open. The tongue closes the sound outside. It will not allow the tongue closes the way, and it will close, and the sound comes from nose. The back side of the buccal cavity will close the sound. It will not allow. So no sound comes from the nose. Are you able to identify this particular sound? That is what is tested here. Okay, fine. Right? Nasal sounds. Right. Next one. So recovery and recovering, both you feel that they are right, but no. The testing is something different here. Okay. Next one. Third one, has a dash. So next one. Question 03. Has a dash. 7, 6, 5, 4, 3, 2, 1, submit. Yes. Nobody has written. I have given so much time. Okay. Simon's lecture, SIMMON''S. Okay. Teacher's handbook, ''S. My brother's computer, ''S. And second thing is punctuation, capital letter. Okay, capital letter. Right. Yes. All of you participated. Okay, I am full of interest. Don't make me lose my interest. Yeah, that is the answer. Parkinson's disease. Parkinson should be capital, disease should be small letter. Parkinson is the name of a person, so P should be capital letter. ''S means the disease of Parkinson, like that. So fine. Next. Fourth one. Type and keep your answer ready. Okay. Question number 4. So 5. 7, 6, 5, 4, 3, 2, and 1. Submit. Only the active participants I will be inviting to the group. Remember once again. And I will not invite you for the reading session. Those who are inactive participants, they will not be invited. I'll take the list from the Zoom and I'll see only them I'll be calling. Okay? That's the fact. That is what I do. Only those students who are desirous of learning, who are interested in learning, them only I'll invite. Yes. So I see participation. Yes, next question number 5. So dash, shake a lot. Dash, shake a lot. So 7, 6, 5, 4, 3, 2, 1, and submit. Right. Yes. Question number 6. Okay. 7, 6, 5, 4, 3, 2, 1, and submit. Okay, question number 5. Okay. Afterwards, I'll give you the answers. You submit, no problem. Afterwards, I'll give you the answers. See, those who are not serious left, that's it. No problem. We don't mind non-serious people. Okay, next one. 6th one is over. Then 7th one. Question. I'll give you the answers. Then afterwards, you should check and tell me. So question number 7. Yes. 7, 6, 5, 4, 3, 2, 1, and submit. Yes. Question 08. Yes, question number 8. Question number 8. Okay. 7, 6, 5, 4, 3, 2, 1. Submit. Question number 8. Okay. Question number 9. 7, 6, 5, 4, 3, 2, 1, and submit. Yes, question number 10. Untidy dash. 7, 6, 5, 4, 3, 2, 1, and submit. Okay. Right. Handwriting is one word, Romila. Handwriting is one word, not two words. Okay. Next. Question. All the regular students who have registered, okay, you have to, because next session is only for the registered students, not for an open session. So all the registered students who have completed the test, they have to post, okay, to me particularly. You have to send me your score. Is it, even if you get 0 also, no problem, but you have to send me your score. Okay. Right. Next one, question number 11. 7, 6, 5, 4, 3, 2, 1, and submit. Monica, S should be small, not capital. Monica Vinod, S should be small, because in the middle of the sentence, nobody will use a capital letter. Monica is a new student. Yes. Question. She registered for the new batch. For those students who went for the exam, new batch started today only. So she is a fresher. Right. Question number 12. Question number 12. 7, 6, 5, 4, 3, 2, 1. Submit. Yes. Now I'm going to give you the answers, show you the answers. Okay. You can correct your answers. Here is the answer key. One by one, I will show you, so that how it is. There are some mistakes here also. Don't think that because somebody has written this one and posted here, so there will be mistakes. This is not the official OET answer question paper format. In the OET website, from you take there, or from the OET books you take there, there will not be mistakes. But somebody has typed the answers and they have prepared the answers and there are mistakes. I'll show you. How can W be a capital letter in the middle of the sentence? Lump located near, in the middle of the sentence, which mad fellow will put a capital letter? Even a 5th class boy will not put a capital letter. But here in the official, here in the answer sheet, there is a capital letter. So don't think that capital letter, if you're right, it is correct. You will lose your mark because you don't know these are all bullet points, and bullet points will not have capital letters. There's a rule. That's the rule. And you are breaking the rule. Punctuation problem. Write down. Punctuation problem. Unnecessary capitalization. That is the problem. That is the cancer. That is the disease. That is the ailment. That is the sickness. I'm treating it. If you want to get it treated, otherwise you suffer. That is your problem. You come to me for a solution, that is my problem. You are my problem. You have some problems, I will solve. I'm giving you the solution. Treatment is appropriate punctuation, necessary capitalization. That is the treatment. If the screw is loose, if a screw is loose, not loose, loose. Okay. LOSE, loose, is different. LOOSE is loose, sa, not za. Okay. If the screw is loose, you have to tighten it. Punctuation is not right, you have to make it proper. So unnecessary capital letters you should not put. So that is the problem. So it should be a small letter. Next, recovering. So recovering, it's a mistake here. So let me correct it in the paper itself. This is wrong. This must be small letter. Yes, that's right. The next one is recovering. So recovering, will there be a capital R in the middle of the sentence? Everyone will say no. See, in the beginning, this is a bullet point, my dear, bullet point. So after a bullet point, there will not be capital letter even in the beginning of the bullet point. So how dare you use a capital letter? Capital letter means a king. How can you give a king a soldier's position? How dare? Very powerful point, I'm telling you. If you want to ignore, at the cost of your score, I have no problem. Teaching me is my responsibility. I'm teaching you. Take it or leave it. Some people say, sir, your lecture is too much, sir. It is long, sir. Yes. What we did not learn from nursery, KG to PG, we did not learn. Suddenly we'll come and learn all of overnight. You need to learn some rules. Next. So in the middle of the sentence, you'll never place a capital letter. So R should be small letter. That's it. You see in the official OET, there will not be capital letters. You take the examples of official. Okay, here it is capital letter and it's a must. Parkinson's, P capital. This is okay. It is the demand. It is required. You cannot write small letter here. You write a small letter, then it is a mistake. And if you don't put an apostrophe, it's a mistake. You should know that apostrophe S means of, disease of Parkinson, belonging to, related to, that's the meaning. Simon's glasses, spectacles. Simon's means belong, specs belonging. Simon's computer, computer of Simon. That's the meaning of, means belonging to or related to. So that is the rule. If you don't know punctuation, that's punctuation mark. So capital letter must be there, apostrophe must be there, and disease, small letter must be there, not capital letter, because disease is a common noun. Parkinson is a proper noun. This is why many students are losing marks. And they say, spelling is okay. Spelling is, what spelling is okay? It's not just spelling. There are many things which go in between. Next one, walking. Many people don't know why they are losing their marks. Okay, spelling is okay. What about punctuation? Why are you ignoring punctuation? How can you put W capital letter? Sir, there will put. If you cannot put here, how can you put there? It's not there in your mind only, punctuation. Whatever, write all the regular students. I demand this from you. Okay? Walking. Yes. W small letter, not capital letter. Next, fifth one. Answer itself is wrong. 2 wrongs are there in this answer. 4 letters, but 2 mistakes are there. 4 letters, but 2 mistakes are there. This answer is not right. If you write hand and if you correct, it is wrong. I'll show you why. You think answers in the question papers, they are right? They are wrong many places. See here. Dash, shake a lot. Shake a lot. Hand shakes a lot. Leg shakes with an S. Okay. Hand is weak. It shakes a lot. Hands are weak. They shake a lot. So, singular and plural controversy. So, the answer given in the question paper is wrong. It's not a hand, it's hands. This is called singular plural controversy. You should understand whether it is singular or plural. If you write hand, it's a wrong. Blindly put an into mark. What you will do? Put a tick mark. When you do the test, you will get 32, 33, 34. In the exam, 28, 27, 26. My dear children, you don't know why you are losing your marks. Oh, I wrote everything right. I know, sir, perfectly right. I have written 100% guarantee I will pass. But result failed. Why? Because of this. Because, okay, spelling is okay to some extent. But he tells if the meaning is understood. Okay. If the meaning is understood, it is accepted. Not always. If the meaning is not understood, okay, then you will lose your mark. And for ordinary words, if you don't know the spelling, you will go get only the names for medication or some hi-fi. It's not for English. Huh? Spelling for medication may be permitted. Not for everything. Be careful. Spelling's okay. No, sorry. Stiff. S a small letter. See, every answer. Turning over. Standing. Trouble standing. Why capital letter? I'm correcting every sentence. Okay, buttons. Doing and undoing buttons. Why capital letter in the middle of the sentence? Remember, handwriting. Handwriting. Where from the world he got this answer, I don't know. Whoever has written this one. Okay, fine. They tried to do some good. But in doing something good, he is teaching something wrong here. So, I'm not telling this is right or wrong. Let us go to Cambridge Dictionary. Let us go to Cambridge Dictionary. It will tell us whether it is right or wrong. I am not an expert. I am not OET. I am not Cambridge Dictionary. I am a very ordinary teacher. very ordinary teacher. That's all. I don't say that I'm an expert teacher. I don't even say that I'm a better teacher. I'm a very ordinary teacher. But OET is my strength. Cambridge University dictionary is my strength. Through them, I'll prove everything for you. Okay. For example, if a child is walking alone, mother will say, you should be careful. Why were you not careful? But if child goes along with his father or her father, mother will say, you are there still, why did he fall down? What, you are not taking care of? So mother will shout at father, or father will shout at mother. That is the point. Understand? Because that time the child's mistake is not there. It is the father's mistake, because the father is there, still he fell down. That means father's mistake. So I don't want to do mistake. I will go along with my father and my mother. That's it. So I can say OET is my father and Cambridge Dictionary is my mother. So I'm going with them. I don't think that I will do any mistakes if I take their names. Right. Now here you type this word HAND. Yeah. And space, same as it is I am typing. Space WRITING. There is no word in English dictionary. How did this answer sheet come right? Now tell me. In the Cambridge Dictionary, there is no phrase called hand and writing. I'll just click open and it is showing you some suggestions. This is what it is. Yes. That's it. So here, this answer sheet itself is showing something wrong. Somebody like Simon has done it. I am Peter, sorry. Simon has done it and put it there in the internet. They have put there wrong and you are correcting and you are giving right mark. That is what I am telling. There are many people who will not guide you properly. So be guided. Don't come to me. Go to Cambridge University Dictionary. Go to OET official website. Study from there. Many people will teach many things. Don't listen to them. Go to OET. Go to Cambridge Dictionary. They will teach you properly. Handwriting is one word. You can see here. Handwriting is one word. How can you write it two words? You don't know the difference between separate words and compound words? Hand and writing are two isolated or separated words between. There's a gap in between. There's a space in between. How can you write like that when there is no such combination? There is no combination. It's handwriting, one word, compound word, like blackboard. Is it one word or two words? Is the question in topic. He's testing you whether you know that it is one word or two words. He's not testing you whether you know that it is handwriting. No. He is trying to test you the deeper insights that you have. The idea between one word or two words. And you feel that the answer is right? No, not at all. That is English. Just writing something is not English. Profound knowledge. Okay? He's testing you whether you're an expert or not. And this is B1 level, not even C1, not even B2, it's B1 level. What do you mean by levels? You know, this is B1 here. B1, do you know what is this blue mark here? B1, above this one here. B1 means, okay, A1 means elementary, beginner. A1 means beginner, nursery KG student. A2 means first, second, third, fourth, fifth class students. B1 means 6th to 10th class student. That means this is the level of the word for 6th to 10th class student. That means we don't know that level also. He's testing your level of the vocabulary. He's not testing you the word, whether you caught the word or not. Caught the word, but whether you are presenting it properly is important. You cook food and nicely you decorate and put it in a plate in front of your husband or wife or children, or brother or sister or mother or father. You nicely decorate everything in place. Rice one side, chapatis one side, vegetable one side, chutney one side, everything. You decorate it and keep it. You just don't throw everything in a heap. However you want to write, you cannot write. Nobody will like that. That is called presentability. It is one word. And how can you make it into 2 words? There is nothing like that. Dictionary is not showing you, then how can you write? That is what he is testing you. And you people feel that I have done the answer. I have given. OET is making money. Some people say like this. It is like looking at the sky and spitting. The spittle will fall on your face only. OET is very high. Of course, there are some people who are doing some nonsense things. Okay. There are many people on my channel also. They come and post leaked papers, that papers, these papers. That is not our problem. Somebody is doing some wrong things. That is not our problem. We are working hard. God is there to bless us. That's all. Okay. So that is what I am telling you. Learn in the right way. Just writing, handwriting, no. And many people wrote H capital letter. That's also wrong. It's one word. So I have proved that in the answer sheets also there will be many words which are wrong. So be careful. Don't just be misguided because of those things. Go through the right point and from there you have to get the information. So handwriting here, there are two mistakes. One is H is a small letter. Then writing W is okay, one word, handwriting. That is the right answer. This is the right answer. I have corrected the answer sheet itself. You can see there. And this is not official answer sheet. Don't think that somewhere we got it on the internet and we are taking it and we are learning. We are learning. Learn the rule. There are some things called the logic he is testing you here is, I am an English language teacher trainer. I'm not teacher, I'm a teacher trainer. Okay. So that's why I teach teachers how to teach English. So what mistakes teachers do, I can catch. That is the point here. So now, when you are presenting, the logic between here is whether handwriting is one word or 2 words. That is being tested. Whether you have the knowledge regarding compound nouns or not. That is tested here. This is a very difficult range of question. It's not easy. Not everyone can understand. Okay. Next one, sleep. S, a small letter. Reduced, R, small letter. Okay, fine. Right. Now coming to the point. Scores, please. Type and keep it ready. Only when I tell you to submit. Scores, please. How you have to submit is, for example, 7, okay, out of 12. So your score, just type the number, that's all. By 12, no need. Score, okay, if you have written only 8 questions, then you came late. Okay. Then you can write like that. Otherwise, no need. Okay, score out of 12. So don't submit until I ask, I'm telling you. Okay, 7, 6, 5, 4, 3, 2, 1, submit. Submit your scores. Yes, and those, I'm going to send a new link only to the regular students. This was an open session. Okay, so reading session, I'm going to explain the tips. Okay, there are many things which you learn. So only the regular students will be joining. Okay. Yes, now let us see. Yeah, all of you submit your scores. Yes, now let us see here. Yeah. Anyone got 12 out of 12? Okay. Binsi got 10. Nusrat got 9. Romila got 10. Manpreet got 10. Oh, Hima Teresa got 10. All our regular students. Okay, very good. Very good. Sorry. Yeah, let's start with Binsi. Hello, Binsi. Hima also got 10. Yeah. Now I'm giving you a chance to unmute. Unless until background is silent and not disturbing, then you can unmute. Yeah, Binsi.
Yes, sir. Hello.
Tell me about your experience, Binsi.
Yes, sir. It was an immense pleasure attending this listening session because there were many things which I have learned, which I was not knowing actually before.
One second. First of all, can you introduce yourself, because others will realize what you are and why you are learning from me. They should know, because you are not just something, you are something different. Come on.
A very good evening to one and all. It's an immense pleasure to introduce myself to you all. My name is Binti Robin. I'm working as an associate professor in nursing college, and I'm from Bhopal. And I'm attending this session from last 1 month. It had been a very good experience under Simon sir. He's a very good guide, and I learned many things actually, especially in listening and reading. I was very weak, but I myself found a change in that module now. So I'm happy that I'm a student of sir. Thank you so much.
Okay, so fine. She's a professor in a college, nursing college, associate professor in a nursing college, and she is as meek as a lamb. She will never open her mouth. I said, do that. Yes, sir. That is the level of obedience she has. That is what will make you a deserving candidate. Until and unless that is not there, we will never learn. She is a professor of nurses, and she is like that. That's the difference. So if she says how much difference this training gave her, then you can understand the importance of learning in a different way. Successful people don't do different things. They do things differently. Their style is different, their attitude is different, their presentation is different, their everything is different. Same things they do. Everything will be different. Yes. Many people, they say, reading and listening, nobody can teach you. You do it yourself. Reading and listening without the help of a teacher is very difficult to do. Writing something you can write. Okay. Speaking something you can speak. Something you can do. But reading and listening, you must have somebody to guide you, because there are many concepts which you will never know. That is the place where you need a teacher. And when you are learning, do that one. Step-by-step procedure. Next, Hima Teresa. She is also my student. Hima Teresa. Hello, Hima.
Hello, sir.
Yes. Can you share your experience, Hima? What is the reason why you got 10 and 11? First of all, tell where you are from.
Currently, I'm in Abu Dhabi.
Yeah. Yeah. Introduce yourself, your name, and then afterwards start. Explain.
My name is Hima, and I'm currently in Abu Dhabi. Mm, what I will just.
Yeah. Share your experience.
It is nice pleasure to be a student of you, sir. Because I
Simon
am
sir is
learning
there.
every day, means different things. There will be for the punctuation, for the letters, how it will be produced and how can be corrected for the listening and reading. Or the like as you said, the singular, plural nouns, and there will be the following term will be how will be occur like that. There are more things I am learning every day. With your writing correction also for the classes also, it's very much helpful for me.
Yeah. Next, Manpreet Kaur. Today, this
Good.
Manpreet Kaur. Yeah, please, Manpreet Kaur, come on screen. Come, open your. Yeah, Manpreet. Today morning, you were telling me, sir, reading, listening, I get very less in part A. Am I right?
Yes, sir.
Okay, fine. So, can you
Yes,
introduce
sir.
who you are? Because people have to know who you are.
Good evening to all. My name is Manpreet Kaur. I'm working as a assistant professor in a nursing college. I'm from Sirsa, Haryana, and I am attending this session last 15 days, and now I can learn more things about how to speak to someone and how to organize the letter. Everything Simon sir explains very well. And now I am happy the student of Simon sir, because Simon sir teach to us in a different way. In 24 hours, every time I send to the message Simon sir, and within 1 second Simon sir reply to me and give me a solution of my problems.
So she is a nursing college professor, and what she is telling, I don't mind whether you take my name or not. That is different thing. What she is gaining is more important. She is not an ordinary nurse. She's a professor in a university or college. Okay. So when these people are learning so many things, and I'm very happy when I tell, do this and get up from the seat. Until and unless, yeah, tell me about that, what orders I give, Manpreet.
Hello.
Yeah, tell about what type of orders I give. Until you complete, you will not sleep, or like that, you will have some idea about my
Yes.
style.
Yes, sir. Every time, sir, tell to me if you not submit your mock test, all listening, reading, writing, and all thing. Until that time, you don't go to your bed, and you don't want to sleep. Firstly, you finish your task. After that, you can go to your bed.
Yes, these are two professors. Manpreet, what did I tell you before joining? I'll give you admission only if you, regarding your work, did you take
Hello.
leave or no?
Yes, sir.
Did I tell you to take leave?
Hello.
Did I tell you to take leave
Sir.
or no?
Sir.
Hello?
Sir, your voice is breakable. Please repeat it.
Yeah, I told you to take leave
Hello.
from your work. Yes or no?
Yes. Yes, sir. Yes, sir.
So did you get the benefit because of that?
I was taking a leave for only OET preparation, at least 2 months.
Yeah,
Now
that is
I utilize my leave to gain something regarding OET, how to organize and how to speak, because my speaking and writing is too weak as compared to my listening and reading. So that's why I'm very nervous. I told to the Simon sir, please help me. My writing and my listening is too weak. That's why I'm very much nervous about it. Now Simon sir guide me day by day. Now I'm approve myself, and uh, uh, and I realize that I learned so many things in the last 50 days.
yeah. Okay, Bincy Robin, have you taken leave or no? When I told them, they blindly took the leave. They took leave and they are preparing. So, Bincy, can you share your experience? What did I tell you regarding your work?
Yes, sir, definitely. When I joined the session, at that time, sir told me that I will only make you my student when you at least take leave, because without leave, if you are joining my session, it's of no use. So it was very difficult for me because, my college is very strict and I cannot get leave in that in this session. But still, I requested principal madam and I got at least full 15 days leave. I was completely dedicated, and so it was very good, because once we go to college and with work, it's very difficult for us to concentrate. But when we are fully dedicated to our work, definitely we'll get success in that. So it was very good, and really thanks to sir for giving me this a way to how to reach till the success.
Yes, Dr. Kirtesh from Bangalore.
Hello.
Yes, Dr. Kirtesh, can you share your experience, what you learned today?
Yes, sir. Good evening, all of you. I am Dr. Kirtish from Karnataka. I'm currently working in Chikbalapura. I joined sir's class on 1 month back, and it was really wonderful. We are learning day by day. Each day we are learning new things, and we are improving day by day. That's a good sign. And sir teaching style is very different from other teachers, but it's really effective at the end of the day. And thank you so much for teaching us. Thank you, sir.
Right, there, Romila. Hello, Romila. 10 out of 12. Romila.
Hello, sir. Good evening.
Good evening, dear. How are you? Very strong voice, my God. Come on. Yeah.
Yes, sir. Praise God. I'm good. And I just want to tell and give you thank you that it was very nice session. Actually, I joined Sir Simon from the last 90 days, I think, over. I booked my OET in the January, but I started very early because of the timing issue. But Sir Simon teaching is very different, and especially every time when you attend the lecture, this half hour lecture is like a 1 day teaching. So thank you so much, sir. And today what I learned that how to choose the answer is like singular plural controversy. This I never put attention on that particular point. So it is very helpful. God bless you and thank you so much, sir.
Right. Thank you all. So, I need a break, because if I take a break, I can take another session. So now it is 9:15. So maybe we'll take a break of 20 minutes, and I'll get rejuvenated strength. Then we are going to do reading. I'm going to take classes, whether anybody is there or not. Even if one student is there, I'll take the classes. That's it. So I'm going to start my reading, and those who have attended, they send me personal messages. Okay. And if many times, okay, once a week, I'll give free sessions, open sessions. If anybody is interested, you can get my number here. This is my number. Okay. Seats are already filled up. Yes, I gave 7 seats. All the 7 seats are filled within one day, 24 hours. Okay. So the students went for the exam on Saturday, and I told yesterday, and by today, all the seats are filled, 7 seats, and that's a close. Fine. But if there are any students who want only reading, only listening, or only writing, or only speaking, they can ask. Otherwise, the full course is closed. Okay. So this is my number. I'm going to give you. So, and you can attend the video sessions also if you want. So, yeah. So here it is. This is my number. You can message me and I'll add you to my free groups, open groups. So you can join there. And if anybody is interested, only listening, only reading, only writing, or only speaking, individual sessions. So then you can request me. And if you are really interested and you are really dedicated, then your request will be considered. Okay, if you are serious only, I will see that you're serious, then only I will accept. Otherwise, I'm sorry, I cannot, because I don't have the patience when students are not really serious. Okay, they give the last position to English learning. First duty, because we get money. Otherwise, they will fire from job. So that's why we'll give first preference to work. Second preference to family, children, everything. So like that. For whenever you come to me, you have to forget everything and you have to prepare. Otherwise, sorry, Simon sir will not entertain. If you are really serious, get good result and get good name for me. Okay, fine. So YouTube also, I will give you the link. So if you send me personally on my WhatsApp message, okay, fine. So we'll meet exactly. Okay, now I will give you a poll here. The poll will be like this. The poll will be, yeah, regarding what, where is this? Yeah, here. The poll will be regarding, okay, the poll will be regarding time. So now 21:20. So I'll give you 3 options. So 21:20 Indian time. That means it is 9:20 here. So 3 options we'll take. So 9:40. 9:40. That means after 20 minutes. Okay, break 20 minutes. I'm giving you option 20 minutes break. A is 20 minutes. B is 30 minutes. C is 40 minutes, because the lecture will be very tough and reading especially very tough. You know that. So this is 40 minutes. So A, B, or C, select any one. A, B, or C, select any one. And the lecture will be around 45 minutes to 60 minutes. Okay, Binsi, count please. How many A's, how many B's, how many C's? Count and write, please, Binsi. Binsi will count A's. Then Anila will count B's. Manpreet will count C's. And type division of labor. No confusion. Then we'll decide. Whichever is more, we'll decide. Write down A5, B, C, B3, C2, like that you have to write. Count total and write. So stop. Poll is concluded, finished. Now count and write. A's 7, B's 1, C's I want to clear. Okay. 2B and C, only one student. Okay. So 20 minutes, exactly after 20 minutes, we are going to meet. Okay, send me personal message and you'll get the link.